If you share a bed with someone who snores, or if you've been told that you do, this video is for you. Snoring is not background noise. In many cases, it's a sign of obstructive sleep apnea, a condition affecting roughly 1 billion people worldwide, where 80% of cases are never diagnosed. I'm Dr. Kurt Hong, professor of medicine and gerontology at USC. I've spent my career in proactive health, thinking about what accumulates silently before we start paying attention. Sleep apnea is one of the clearest examples. Here's what's happening. During sleep, throat muscles relax and the airway collapses. Breathing stops. The brain detects the oxygen drop, triggers a stress response, and the person rouses just enough to restart breathing, then cycles back to sleep. This can happen 5 times an hour. It can happen 40 times an hour. The person usually has no memory of any of it. Severity is measured by the apnea-hypopnea index. Breathing disruptions per hour. Fewer than 5 is normal. 5 to 14 is mild. 15 to 29 is moderate. 30 or more is severe. Why does 80% go undiagnosed? Because the symptoms are almost perfectly designed to be missed. Patients don't remember it. You don't experience yourself stopping breathing. You just wake up tired and assume that's how you are. Partners normalize the snoring. Daytime symptoms, fatigue, morning headaches, cognitive fog, get blamed on stress or age, and physicians often don't screen unless specifically asked. What does untreated sleep apnea actually do? Every apnea event triggers a sympathetic surge, adrenaline, blood pressure spike, heart rate spike, repeatedly, all night. The result is hypertension often resistant to medication. 30 to 50% of patients with treatment-resistant high blood pressure have undiagnosed obstructive sleep apnea, or OSA. Sleep apnea is an independent risk factor for atrial fibrillation at 2 to 4 times baseline risk, and in severe cases, significantly elevated risk of heart failure. Metabolically, oxygen deprivation disrupts insulin signaling, elevates cortisol, and drives visceral fat accumulation. Up to 80% of OSA patients also have metabolic syndrome. Weight gain worsens apnea, and worse apnea drives more weight gain, a cycle that's hard to break without treating both. Cognitively, deep sleep is when the brain flushes out amyloid and tau, the proteins linked to Alzheimer's. Fragmented sleep disrupts that nightly clearance. Untreated severe OSA carries meaningfully elevated dementia risk and clinical depression at 5 times the general population rate. One more statistic. Adults with untreated sleep apnea are 2.5 to 7 times more likely to be in a motor vehicle accident. The mechanism is microsleeps. 2 to 5 second lapses with no warning and no sensation of lost awareness. Many patients feel completely normal. Research shows their reaction time matches someone at the legal alcohol limit. Effective treatment brings accident risk to near normal within weeks. Red flags warranting evaluation without delay. Loud snoring on most nights, a partner who has witnessed you stop breathing, waking, gasping, or choking, or hypertension not responding to medication. If any of these apply, call your doctor and ask specifically for a sleep apnea screening. The first-line diagnostic tool is a home sleep test, a portable device worn overnight measuring airflow, oxygen saturation, and heart rate. Covered by most major insurance, orderable by your primary care physician. A fitness tracker cannot diagnose sleep apnea. The Apple Watch, Fitbit, and Oura Ring have no FDA clearance for OSA diagnosis. If diagnosed, CPAP, or continuous positive airway pressure, is first line for moderate to severe OSA and nearly eliminates events in most patients. Oral appliances work well for mild to moderate cases. A 10% reduction in body weight produces roughly a 26% reduction in AHI-GLP-1 receptor agonists like tirzepatide are now being studied specifically here with promising early data. Surgical options exist for patients who can't tolerate CPAP. Sleep apnea is a chronic disease with cardiovascular, metabolic, and cognitive consequences that accumulate silently, usually long before any diagnosis is made. The only barrier that remains is knowing to ask. At your next appointment, say these words: "I'd like to be screened for sleep apnea." Those 8 words could change a significant number of things downstream. Full article with cited references at kurthongmd.com. If this was useful, share it, especially with anyone dealing with fatigue, snoring, or difficult to control blood pressure. Thank you for watching.